know that I take a lot of time during the consultation because I want to explain, I want to let the patient feel that he is in safe hands, and you do the same thing. So because we have a lot of patients which are absolutely scared of anesthesia, they have a lot of questions about anesthesia.
General anesthesia is the way how we make patient bypass all this period when we can expect severe pain or discomfort.
When I have a complex case, etc., I always send it to you in order to have this patient reassured, because it's very important.
I always tell this is my mission.
Exactly.
Dr. Matteo Vigo is a leading plastic surgeon in Dubai with over 20 years of experience in breast augmentation and cosmetic surgeries.
He is also one of the first UAE licensed surgeons to perform Mia Femtech, a minimally invasive breast enhancement procedure that delivers natural results with minimal scarring in less than 15 minutes.
Dr. Matteo Vigo, where precision, expertise, and care come together to create life-changing transformations with natural, lasting results.
Hello everyone, and welcome to another episode of Beauty Talks with Dr. Matteo Vigo. Today we have a very special guest that is making sure that you sleep soundly during your procedure and you will wake up and feeling absolutely amazing. Thank you for being here, the one and only Dr. Jelena.
It's always a pleasure being with you and working with you as well.
It's Dr. Jelena is the anesthesiologist that will take care of you during your surgical procedure. We're working together since 8 years now. And we really have a special bond because we have the same vision in the surgical field and the anesthesia field. So what we are looking for our patient, which is always the best option for them.
I think we're doing a very good job.
Yes,
definitely.
Absolutely. Let's dive into the topic, why I invited you here, because we have a lot of patients which are absolutely scared of anesthesia. They have a lot of questions about anesthesia. So let's start talking, what are the type of anesthesia that you can give to the patient?
I will just start with the thing that it's absolutely normal to be stressed. That is normal human reaction, and this is something, especially the patients who are starting first time doing such treatments. So absolutely, I have approached that this is absolutely normal reaction which needs to be explained, clarified, and supported. So if we go back to the second question, which is types of anesthesia, of course there are different types. There are kinds of anesthesia which are super mild, meaning that they're just affecting patient to be relaxed more, nothing more than that.
So like a conscious sedation, right? We can call it like that?
There is even lighter, which you use for your Mia surgeries, which is a little bit of sedative given to the patient just not to have anxiety. But in combination with local anesthetic, that is absolutely enough for such procedure like your Mia. I will go back again. There is conscious sedation, which is like a level up of anesthetic effect, which means that patient is in kind of I always compare to afternoon nap. You will be a bit of sleepy, but once doctor calls you or needs something from you, like movement, like opening eyes, like opening mouth or whatever, patient will respond 100%.
And I can talk to the patient, right?
And you can always tell the patient what you do and what to expect more. And that is the level called conscious sedation. And then at the third level, which we use for some a little bit more aggressive, but not too aggressive procedure, is sedation, which when we use a medication to make patient completely sleep with the oxygen supply placed on the face. Is it like a nostril tubes, or is it mask of oxygen as well? And then patient has a beautiful nap, no pain, no feeling of whatever is going on, but spontaneously breathing and enjoying the procedure.
And what I love
end.
about this deep sedation, that the patient doesn't listen to us when we are talking, right?
Mostly,
When
yeah.
I say,
Especially
oops, something happened,
yeah.
they don't know, know, right?
No, but there are medication which we use which support this part as well. So patient mostly has no remembrance of whatever was
that's
going
the other
on.
thing. So they don't feel in the moment, and even they feel something, this medication cancel their memory, so they don't remember what happened.
Absolutely, they just wake up in smile, which we always want to see after, especially after plastic surgery treatments. So mostly we gain it.
Yeah. And let's go to the heavy stuff, the general anesthesia, because lots of people are scared about general anesthesia. That's also why they invented MIA, because one of the reasons the patient didn't want to go to do a breast augmentation was because they were scared of general anesthesia. So they prefer to have this very mild sedation, even in local anesthesia, I did the first cases, I told you, in local anesthesia pure. So what is the general anesthesia? Why the people, what does it involve in general anesthesia?
So this is the magic.
Yeah.
So general anesthesia is the way how we make patient bypass all this period when we can expect severe pain or discomfort during the surgical procedures. This is the highest level of switching off, if I can say, of the patient's brain function, which allows us to do something more aggressive than smaller procedures. This is involving plastic surgeries, this is involving all the other kinds of surgical procedures which are treating some kind of diseases, but all in all, this is the way how in this 20th or 21st century we do help our patients to score the surgical need, which is present in that moment.
Yeah, exactly. I remember, because maybe you don't know, but when I started medicine, I wanted to be an anesthesiologist. I told you this story a few times. And then I decided to go into surgery, and I ended up in plastic surgery. And I remember when I was, going with anesthesiologists, they were telling me that general anesthesia give you three effects. You make the patient sleep, they make the patient not move, and they make the patient not feeling pain. Is it correct? These are the three pillars of the general anesthesia.
So 2 are good for patient and 1 for surgeon.
Exactly.
So definitely patient needs to sleep, needs not to have pain, and patient needs to be relaxed for the surgical performance.
And that's why we use
together,
a tube, a breathing support,
yes.
because when we block the muscle with some medication, the patient cannot breathe by themselves. So we help them breathing through this kind of tube. Yeah.
Absolutely. And this is the way how, on the top of this, once we give these aggressive medications, we are doing complete monitoring of all vital functions of our body. We are monitoring the brain function, the heart function, vascular system. We are monitoring kidneys function, lungs, and all performance about ventilation and level of the oxygen. So all in all, general anesthesia is a bit heavy way to perform such procedures, but from the other side, it's absolutely safe one. So this is our job, to monitor body and to control surgical activities as well. If he has problem, we support the surgeons. So altogether, we are the safety part of
Exactly, you're like the director of an orchestra, directing all the instruments in the theater, in the patient. So
this is the teamwork.
And it's very important. That's why I like to work with her, because the communication between the surgeon and the anesthesiologist is very important. Because at that point, I can tell, the patient is bleeding too much, maybe the blood pressure is a bit high. She checks the blood pressure and we communicate. Or she sees something that I don't see. I say, stop a minute, I need to check this thing. And if there is this communication relationship also, because it goes even, outside the operation theater, because we are friends in life. And it's very important that you have this trust in each other, because you know what I'm doing, I know what you're doing, and we don't have to, take something or tell something to you, because we know that everybody's doing their job in a very professional way.
And it's very smooth, absolutely.
Yeah. And you see she works with a lot of other surgeons, because she's responsible for the anesthesia in the hospital. I'm doing the procedure, and so she sees a lot of other surgeons. And when you have the kind of security that the other side is doing the right job, less harmful for the patient. And she knows I'm very quick. She always surprised by my surgical timings.
Absolutely.
I book the theater maybe for
but
longer.
I learned to follow you.
Exactly. And also very important, because the longer you take the anesthesia, the longer is also the awakening and the recovery for the patient. So if you do small surgery, the patient is awake in a blink.
Working with you, I have a fast surgeon and very efficient one with no complications.
Touch wood, let's say.
This is my experience, yeah.
And because you see a lot of patients every day for the consultation, pre-anesthesia, what are the fears? Because you mentioned at the beginning the fears. What are the fears that they report to you?
Yes, mostly two. Besides normal fear of something which they don't know what's going to be, there is a fear about the anesthetic part, if they're going to wake up through the surgery, or if they're not going to be awake after surgery. So
what if I don't wake up after?
Absolutely. So these are mostly fears that I experience on daily basis, which is again absolutely normal, and people are informed now. Nowadays, you have many places to learn about many details in medicine, so anesthesia as well. But generally, that's why I always tell the patients and the surgeons to send the patients before surgery to talk to the anesthesiologist. We are going to explain in details every part of our performance. And then once they come on the day of the surgery, there is less than 50% fear than it was once they came for the pre-anesthesia consultation.
And I can absolutely assure you that she is like the mother of my patient, because she's really protective towards them. She make them feel very comfortable, and people love you because of this, because they really feel safe in your hands. While sometimes in the past I've had other anesthesiologists that maybe they're a little bit quicker, they have very short time to talk with the patient, and they feel like, oh my God, he didn't give me enough. That's why I know that I take a lot of time during the consultation, because I want to explain, I want to let the patient feel that he is in safe hands, and you do the same thing. So it's when I have a complex case, etc., I always send it to you in order to have this patient reassured, because it's very important.
I always tell this is my mission.
Exactly. Let's go into the technical details. So how we do a lot of blood tests before the procedure, because we want to make sure that the patient is healthy for our procedure, especially in my field that we are doing elective procedure, which means they don't need the surgery. They're not life-changing, yes, but not life-saving procedures. So we need to be sure that we are not taking this in a very simple way, and that we do all the blood tests. So apart from the blood test, how the patient can prepare for the surgery? What are your suggestions to give to the patient before?
During pre-anesthesia consultation, once a patient finishes a questionnaire, I can have a first look about the patient's state, the patient's problems, eventual treatments, medical or medicamentous. So considering these details and data, I always do some kind of suggestion to the patient how to behave. Generally, firstly, about their own body, when to stop some medication, when to use some medication. And secondary, we always do this fasting introduction about when patients should stop eating, when should patients stop drinking, and when to come to the procedure. Once patient comes before procedure, we do as well some kind of pre-treatment, meaning to diminish possibility of many complications, which are quite not complications, a little bit difficulties, which might happen during first few hours after surgery, which is mostly nausea or stomach discomfort or a bit of dizziness. So to diminish all this, we are giving medication which are neutralizing all these happenings, and mostly, as far as I could tell, as you said, touch wood, but these kind of problems are very rare.
Okay. And what, so we talk about the before the anesthesia, what the patient should expect after the anesthesia. Again, you said a little bit of nausea, dizziness, etc. How long do you usually last after the anesthesia finishes?
So our definitely aim is once giving medication before procedure to give some of this helping medication by the end of the anesthesia. So mostly just follow up, good monitoring after the surgery, and our presence is enough to make frequency of these problems very, very low. So patient definitely can expect discomfort about surgical site, pain which can be followed by our presence and our ordering medications, and problems about anesthesia, meaning sickness, vomiting, or a bit of sleepiness after surgery can be followed very easily. So generally we have very happy patient after 1 or 2 hours after surgery.
Yeah, exactly. So I remember when I was studying medicine that everybody was saying, to defeat the anesthesia from your body, to clear your body from anesthesia, it takes up to 1 year, because we were using a lot of gas before, the sevoflurane right before. Now we're using this in a very low doses, so this doesn't stay in the body that much. And all the medication we inject in the vein, the moment you stop them, the patient wakes up. Right?
Yeah.
Am I right?
Good judgment, good dose of the medication, and good information about patient's health help us a lot to get the best score after.
Yeah, exactly.
But complete evaluation is very important.
Okay, so we when we work together, I always try to find out the best way to deliver the result with the minimal discomfort for the patient. As I said many times, I'm faster, not because I'm less detailed, but just because I know that the less I traumatize the tissue, the faster the recovery for the patient. And I like working with you because you are the same concept as me. So the moment you do like an anesthesia, you know that the minimal doses that makes the work, but doesn't overdose the patient, doesn't make the patient feel drunk and drowsy after the procedure, gives a faster recovery. So the synergy between anesthesiologist, surgeon, and the scrub nurses also, because it's very important, is a team that we are in the theater, and we listen to our music, we have our moments. It's our safe space, I can
Absolutely.
say. I can say that we are like some people are sportive athletes. They feel when they're in the field, they are running, they are doing the exercise. We are safe there. We are in our space, and we have the right knowledge to manage whatever can happen, because
of course
it's important. It's mathematics to dose the things.
Absolutely.
But it's also an uncertain part that we always take care in consideration. So the risk of complication can always occur. The most important part is that we are ready to take care of them. So,
to understand the situation, many times we had very difficult patients. But as far as I remember, everyone was perfect.
Yeah,
after
she had
the first
I remember, a few months ago, you told me that the moment you induce the anesthesia, one patient get, heart problems, so you have to sort this out. And of course, if you have
severe
the knowledge,
it was resolved in few minutes.
Exactly. So you have the knowledge, and you don't panic, because some doctors, maybe they're younger, they don't have experience, they see these things and they panic. Oh my God. I remember the first time I was in the theater with my ex-mentor when I was in Italy. The first time I saw a blood vessel, I was, oh my God, what's going on? And he said, relax, the patient will not die, for it's a small vessel, you just coagulate, and it's the same thing. So the experience makes the team.
Difference.
Absolutely. I think, we cover. Do you have anything else to add from your side to our patients?
Yes, I would always suggest Dr. Matteo Vigo, because I am the one who is always behind of his work, and definitely I am supporting him as anesthesiologist, but very skilled and very confident surgeon. And regarding anesthesia, 21st century experience, availability of medication are making difference. So this is the situation that we have now.
And also
in our practice,
choose your surgeons, etc. Also the facility where the surgeon is working. That should be a full hospital. We know some
Absolutely,
small
always.
clinics that are doing, this kind of quick treatment that is absolutely not suggested, because you don't have the possibility to support the patient with something serious happen.
Absolutely.
Safety is our first word, and we want to make people absolutely safe. We check all the allergies, all the medication you're taking, in order to be absolutely sure that your process will be absolutely flawless and smooth, and you don't face any problem. We don't face any problem, because we also want to have, to want to sleep at night and not have, thoughts about
That's our devotion, absolutely.
Exactly. So I think we can wrap it up. It was a pleasure to have you here. Outside the theater one time. Yeah. No, not the time, because we see each other sometimes for a change, not in the scrub. If you have any other question, please feel free to ask me. Subscribe to my YouTube channel and put a like to this video if you like the content. There will be maybe some more interaction between us. We'll do some maybe Instagram shots or something. So I will put her face towards you, so you know who are you talking to. And absolutely stay safe. This is our most important message today. We will take care of you. Thank you so much. Stay safe, and I'll see you to the next episode of Beauty Talks with Dr. Matteo Vigo. Because you deserve the best.